Assalamualaikum warahmatullahi taala wabarakatuh, and a very good evening, ladies and gentlemen. I am Professor Dr. Muhammad Yazid Jalaluddin, and I'll be chairing the session for today. I would like to warmly welcome everyone to our webinar titled Integrated Approach to Promote Child Growth, which is organized by FrieslandCampina Institute in collaboration with Malaysian Pediatric Association, Malaysian Society of Clinical Psychology, and Family Medicine Association of Malaysia. This webinar has also been accredited with 1 CPD point by the Malaysian Medical Association. Thank you for joining the event today. We are very fortunate to have a panel of esteemed speakers with us today with vast knowledge and experiences to share a comprehensive overview on the topic of child growth. Before we proceed, I would like to remind everyone on the breastfeeding disclaimer and some housekeeping notes. So please note that breastfeeding is the best nutrition for healthy growth and development of babies. Exclusive breastfeeding for 6 months is the optimal way of feeding the infants. Thereafter, infants should receive complementary foods with continued breastfeeding up to 2 years or beyond. Mothers should receive guidance on proper maternal nutrition in order to help sustain an adequate supply and quality of breast milk. Usage, preparation, and storage instructions of breast milk substitutes or of complementary foods and drinks should be followed carefully, as improper or unnecessary use may pose a health hazard. Let us look at some housekeeping notes. For optimal viewing experience, please view the presentation in full screen mode. Q&A session will be conducted during the panel discussion. Please post your questions in the Q&A box. All participants are encouraged to fill out the evaluation form at the end of the event, especially if you would like to receive the 1 CPD point from the Malaysian Medical Association. This will help us to improve our events in future. Now, just to give you an overview of our speakers today, we are pleased to have Dr. Wahyu Taher, Consultant Family Medicine Specialist from Klinik Kesihatan Simpang Kuala in Kedah. We also have with us Professor Hamid Jan bin Jan Mohammed, Nutrition and Dietetics Program from University of Science Malaysia, and Professor Alvin Ung Lai Un, Associate Dean, Engagement and Internationalization, School of Medical and Life Sciences, Sunway University. And these are very esteemed speakers that we are fortunate to have tonight. Should you have any questions for our speakers during the presentation later, feel free to post your questions via the Zoom Q&A box. Now, I am sure all of you are looking forward to the lectures this evening. So without further ado, let me introduce our first speaker for today, Dr. Wahyu Taher. So Dr. Wahyu currently is a consultant family medicine specialist at Klinik Kesihatan Simpang Kuala in Alor, Kedah since the year 2012. She graduated with MB CHB from Glasgow University in Scotland and graduated her master's degree in family medicine from UKM in year 2000. She then went on and had her fellowship training in chronic disease management primary care in Monash University, Clayton, Victoria, Australia. She had a very vast experience in managing children, adults, and elderly at the primary care setting, especially in Kedah. So let us warmly welcome Dr. Wahyu to deliver her presentation on monitoring growth in the midst of COVID-19 pandemic. Back to basics. Over to you, Dr. Wahyu.
Thank you very much, Prof. Yazid. Assalamualaikum warahmatullahi wabarakatuh, and good evening to everybody. I was informed there's quite a huge crowd out there, so I hope we will make sure the 1.5 hours time that you're going to spend with us is going to be a worthwhile experience. So again, thank you very much to the organizer who has invited me for this webinar. So may I have my slides, please? Okay, so the topic given to me is monitoring growth in the midst of COVID-19 pandemic. Back to basics, okay? All right, so growing up during COVID-19 pandemic times. So how does the pandemic affect our children? It is not just affecting the adult. Definitely the children will be most affected because they're a vulnerable group of people. Okay, so let's see how the children are being affected by COVID-19 pandemic. Okay, so to start with, there are some literature reviews, there's a lot of them out there that illustrate the effect of COVID-19 on our children, especially when they are rapidly growing, okay? So this is just another example how the countries like Malaysia, which is part of these low and middle income countries, are being affected. And you and I know that even before the COVID-19 hit us, the world is already out of track in terms of achieving the SDG 2, which is to eliminate hunger and forms of malnutrition by 2030. Now, with this pandemic, we will be reassured that the situation will become worse, okay? And this is going to affect and exacerbate the countries like us or the low and middle income countries with regards to maternal and child nutrition, okay? Now, there are other literatures that also illustrate same thing, but of various stages of our children, okay? Number one, this is a paper that tells how COVID pandemic has actually affected the growth of our children. And this is a systemic review, okay? And then there's also a paper that illustrates the issues on mental health among our children and adolescents. So they may be undemonstrated, it may not be manifested among the children and adolescents with regards to mental health that has been affecting them directly or indirectly by COVID-19, but there has been literatures illustrating and describing these issues. And then when we look at what's going to happen to the next generation, there's also papers saying that with the COVID-19, there has been a large significant numbers of low birth weight among especially countries with lower and middle income countries. So this is going to affect the next generation of the population of the world. So again, the COVID-19 pandemic is affecting every level of the population. So we are just looking at the adult, okay, with regards to NCD, for example, or respiratory disease. We have forgotten about our mothers, we have forgotten about our children, and worse, if the children's growth and nutrition is affected by COVID-19 pandemic, it will affect the next generation, okay? And so let's see how the COVID-19 impacts the child growth and development, okay? So use with wastings, the 6 to 7 million patients or children are affected, okay? And you will realize that the poor become worse in terms of stunting, and even the rich has become poor. And there is food issues distributing among the countries, okay? And this is going to affect the children. We have realized that vitamin A deficiency is very rampant, okay? And also women and child and the girls, they are not growing as much as we expected. And women who are supposed to be conducive to conceive in this era of pandemic has not been fully having or being given the opportunity to have very good nutrition, and this will affect the pregnancy of that particular woman, okay? And about 44 million of the children in the world are experiencing hunger. So there's a lot of things that is affecting the children either directly or indirectly with regards to child growth and development. And here I would like to emphasize the word growth and also development. And these are two different things, although inseparable, that they are interdependent of each other. Okay. So the impact is huge. Okay. We may not see it in our country because we don't have much prospective data to look into. But I think people like us, the primary care healthcare professionals, will be expecting some gory data that is going to be manifested by the population that we serve. Okay. So look at the differences compared to non-COVID times. Okay. Now, the socioeconomic is stable. Okay. A family income was adequate for appropriate nutrition and also growth. Psychologically, they were stable, both for parents and children. Parents have more time with children, okay? So they spend more time, they experience the growth of the child, they stimulate the growth and development of the child. They are less stressed, they're accessible to optimum nutrition, there's supply of food everywhere, okay? And adequate visits to the child health clinic for growth and developmental monitoring, there is no issue to that. Updated immunization schedule, there is no issue taking immunization, and there's always the clinic is always available for them. Okay, healthier children in terms of growth, positive psychosocial development, and reduced infections or medical condition. So these are quite well, I would say maybe optimum or maybe conducive. However, despite the best times before COVID, our children are also being affected with regards to nutrition and growth, but it may be a small percentage, or it could be focused to certain parts of the community. However, when it comes to COVID-19, the effect to the community is at large as a whole and in general. So it's not just affecting certain aspect or certain specific condition of the children in that particular community, but it's actually affecting everyone at every level of the community. Okay. So what are the difficulty faced? So we divide it into patients factor and also organization and clinic factor. So when we have COVID-19, okay, and we have to deal with it, parents do not take their children for regular checkup. It's either because of the MCO, all right, because of the issues of not wanting to bring their children to the clinic because they don't want the children to be exposed to the crowd at the clinic. So there's a lot of issue that parents perceive, and they decided not to take their children for a regular checkup, all right? And the antenatal visits reduced to 88%, and this is about 70% of scheduled appointment. So should target 90% and above for our maternal care. However, it's not happening because the mother gets COVID-19, they become positive, or they are in close contact with a positive case, therefore they need to be quarantined. So they can't actually attend the clinic, right? So in utero, the child, the baby in utero is also already being affected by COVID-19, right? So, and what more when it comes to when the baby is being delivered to the world, right? So you and I must be aware that nutrition starts as early as in utero, okay? We don't think of nutrition the moment the baby arrives into the world, but it's actually as early as conception, all right? Now, reduced care visits among children, similar factors, the children get affected. When you look at the fourth wave of COVID-19, we see more children being affected by COVID-19, okay? And they don't come to the clinic. They cannot come to the clinic, right? They had to be quarantined, and their scheduled visit is being delayed, right? Child health visit reduced to 45%. This is dismal. This is very dismal. We have never touched 45% of scheduled visit for our children. But this year in KK Simpang Kuala alone, there was only 45% of our children attended the KK visits, right? And this is affecting their immunization, their growth, and also developmental monitoring. That's what we do when the patient comes to the clinic. The child comes to the clinic for their immunization. We actually look at their growth. We look at their developmental. We look at their milestone achievement. And we start to do this monitoring whenever the patient comes to the clinic. And this is an opportunity for us to engage the the parents. However, when it comes now with the COVID-19 issue, it has become much, much more reduced. Okay. Visits of children between 1 to 4 years old has reduced to 40%. So it means less than half of our children are coming to the clinic. And it's for various reasons. And it's all directly or indirectly due to the COVID-19 pandemic, right? So what happens to the KK itself? Okay, so we have difficulty. Now, this is when we want to reduce our KK congestion, because this is part of the new norms, the appointments had to be rescheduled, right? And when it has to be rescheduled, parents may not be able to come because it is not the time, or it is something, or the dates being given to them is not conducive, right? And parents not come to us and say, doctor, can we change the appointment? Okay, this is happening at the moment, right? And children comes from the EMCO areas. They don't come to the clinic. They don't attend the appointment, and we tend to miss them. All right. And then when it comes to the restricted movement order, all right, they can't move. They can't travel from their home, and if they're actually stuck somewhere outside of the district, they can't cross the district. So this is happening during our MCO, and Alhamdulillah, currently we are now going into phase 4, phase 5. Therefore, some of the clinic has sort of coming in to the KK for their routine visits. However, there is about a year delay and a year lag, and this is affecting their development and their growth. Okay, an appointment had to be rescheduled because some of the staffs at the KK were contracted with COVID-19. So there is no choice but to quarantine these staff, and also to close, or also to reschedule the appointment. So this is something that is happening, and worse still, because of the COVID-19, we have to mobilize some of the staff to do COVID activities. And this is actually affecting, and this actually results to delay in the scheduled appointment of other children that we serve. Okay, so there's a lot of things happening to our children during the COVID-19. I wouldn't put the blame on anyone. Okay, as far as we are concerned, some of these issues we can't help it. It's something that is unavoidable, but we need to look at health, growth, and also development. We have to make sure, at least now, for example, we have to speed up, the delay or what we have not done during these past 2 years. Okay, at least coming to close to 2 years, that we have to try and catch up what we have left, right? Whether it's reversible, we can't tell. And you and I know if in terms of growth stunting, most of the time it is irreversible. Okay. And then, so why is it very important to look at growth and development? Okay. And why must it be measured early in life? Okay. It is not just getting pregnant, having the child for 9 months, deliver the child, and that's it. Okay. We are fine, and the child will just grow accordingly. Now, the reason is because that we need to make sure these children has optimal growth potential, right? And when it comes to growth, it will also affect the development. Now, it is very much interrelated, okay? And you and I know that in order to give the best conducive growth and development of our children, and to make sure that they have this potential of optimization, nutrition is very important. And nutrition starts very early in life. And in fact, if you ask me, nutrition starts in utero, okay? And this is something that you and I have to do. So sorry, battery of my laptop, right? Okay, and this is when you talk about growth and development, it is also affecting the immunity. The immune system of the children, in order to combat COVID, the growth and development of the children needs to be optimized. Now, we are not going to say that it's only when the children gets infected by COVID, we'll start to increase the nutrition of these children because of the immunity. However, you need to do this before the COVID-19 sets in, right? So do remember, the growth and development of our children will also enhance the immunity of the immune system of our children. So these are the factors affecting growth and development. There's a lot of them, all right? So in other words, definitely genetic factors, but how much the genetic factors is affecting the growth and also development of our children. Okay, so just bear in mind, this is the list that is very important and it is affecting the growth and development of our children. Okay, so let's look at what's happening in Malaysia and let's see how good we are in terms of growth and development and whether stunting is affecting our children. All right, okay. So this is stunting rate in among our children, and we are worse than Ghana and also Thailand. There are states in Malaysia are even worse than what WHO has recommended, which is 20%. Okay, so again, stunting among children in Malaysia is a huge problem. Then we have to look at the growth and the milestone. All right, so why is it so important? You and I know that all this milestone needs to be monitored by us, okay? Of course, by the parents, but we need to engage the parents, right? The growth and development milestone is very important because it involves the physical growth, the gross motor skills, the vision and the fine motor skills, hearing and speech, social and behavioral skills. And this is very important for optimal growth among our children. And what should parents know about growth and development milestone? And this is something that we need to engage our parents. We need to educate our parents why we need to monitor our children, their children with regards to growth and also development. And why is it important for the mother or for the father or for the carer to actually monitor the milestone of their own children? Because the first 1,000 days of life is very important, okay? And it starts from utero up to 2 years, which is 24 months. And this is the opportunity that we have and we want to grasp to try and give the best nutrition to our children so that they have this strong basic foundation to keep on growing, to become the best human being in the world, okay? And they will contribute to the country, okay? Now, this is the developmental milestone, which is you and I are very familiar with, and this is all being in our MOH record, okay, home-based record book of our children. And we want our parents, okay, to look at this book and engage and educate our children and observe their children's development. Because at the end of the day, we want optimized cognitive development, and the cognitive development is optimal and has the best or the highest speed between these 0 to 1,000 days of life. And when you look at this graph, you will realize that the first 24 months of the life of the children will then set the scene of the best cognitive development. And after that, it slows down. So this is the time when we need to give the best to the children so that the cognitive development is optimized and they'll become the best human being ever, okay? So measuring growth and development, common tools and assessments. So going back to basic, we feel that this is something very simple, but it has been forgotten by many of us, and we hope that to bring the interest back among the healthcare providers, especially in primary care, the nurses, the medical officers, and the rest, okay? And we want, this is what is growth and development. And of course, the growth refers to height, weight, and size, but development is a qualitative changes which then results to maturity of our children, okay? And when you and I look at growth per se, we always match it with what WHO growth standards are. And we also have this, which is by Kementerian Kesihatan Malaysia or Ministry of Health Malaysia, that divides it between the male and the female. And we tend to plot the growth of our children using this measurement and this tool. And this is a tool that has been inserted into the home-based developmental record book of our children between 0 to 6 years. And we hope every one of us will then plot this and show to the parents how well the children are growing or how bad the children are growing or the growth is in static condition, okay? So again, I wouldn't say introduce, but just to remind all of you that this record book or home-based record book health record kesihatan bayi by Ministry of Health Malaysia is actually available, and this is now still being used in primary care clinics, and we hope every one of us will use this book and engage our parents and to try and use this book at home and monitor the growth and also the milestone development of the children. Now, the book is very comprehensive. This is the content of the book, and I think we have to applaud Ministry of Health for the effort of coming up with this book, and it has still been used at the moment, and it is a very comprehensive book. Okay, and again, this is something that is very interesting, and I always see that this page is always empty. Okay, the mother doesn't think that this is very important to actually chart the achievement of their children, of their babies, when they actually start to develop in terms of their milestone. And this is to be enhanced and need to be emphasized again and again by our healthcare providers to our parents or to the carer. Okay, and this is also a nutritional guide. There's always a nutritional guide, and there's always something to read, and the parents can always learn from this book. Okay, and it is very important of early life nutrition because it's only 20% that comes from the gene, but 80% comes from the external factors, and the external factors is contributed by the nutrition per se. So the environment has much more impact on your health in later life than your genes. Okay, so if you want to develop a healthy generation in years to come, the early nutritional aspect needs to be taken care of, and we play a very important part in this part of life. Okay, and we hope that our nurses, our healthcare providers, our medical officers will take this effort to engage and also to educate our parents that early nutrition is very important, especially for the 0 to 1,000 days of life. Okay. Right. My slides is not moving, although I'm clicking on the clicker. So right. So how do we promote and enhance growth for our children during the COVID era? And COVID is not going to go off. I think it's going to be with us for the next few years, and we have to live with it. Even our minister has said that it's going to be endemic. So let's go back to basic. And I think if we go back to basic, enhance our basic, we will not go wrong. So what are the things that we need to do? All right. Okay. Okay. My slides. Okay. All right. Okay, adhere to basic COVID-19 infection and prevention control policy introduced and updated by MOH. And we hope that there is no fear of coming to the clinic, all right? And we need to reduce the congestion of the clinic, and we need to adhere to the new norm so that clinic is a friendly place to go. It's not a fearsome clinic, okay? All right, schedule visits for our children according to MOH recommendations, and we need to try and speed up and bring in those who has not been able to come into the clinic. Enhance the use of the home-based child health record book, 0 to 6s, which I have mentioned to you. And then we need to monitor growth, appropriate monitoring, early referral, and parental engagement. This is the issue that I would like to emphasize. The healthcare providers, especially in the clinic, they refer cases when it's quite late, okay? We need to try and bring in and engage other allied health professionals before before the child goes into a point of no return, okay? And developmental milestone needs to be monitored. It has to be looked into, and if there is any a sense of delay in achieving the milestone, the parents need to be educated or to be trained how to stimulate growth and stimulate the milestone so that they can achieve. Some children may just be a little bit slower than others. Therefore, the parents need to learn how to stimulate these children, okay? Early detection of growth faltering and delay milestone, you need to refer early, and you need for early intervention. Supplementary feeding to children above 1 year to complement comprehensive feeding. This is something that needs to be emphasized on and on, right? Exclusive breastfeeding, again, for the first 6 months of life, because it's a very comprehensive feeding, and you and I know early life nutrition is very, very important. Training and guidance to all levels of healthcare professionals, which is going to be continuous. And this is nothing that we cannot sever this particular part of professionalism. We need to bring back the training, because for the past almost 2 years, we have actually stopped a lot of training among the healthcare providers, especially in primary care clinics. Okay, so that's it for me. Thank you very much.
Thank you very much, Dr. Wahyu, for a very informative sharing. I mean, from your sharing just now, it's really alarming to see that only about 40 to 45% of the normal child health visit is occurring during COVID-19. I wonder if you were to look at the statistics, I wonder whether our stunting, overweight, underweight will continue to increase uh, over the last 1 year or so. So I think it's very important what Dr. Wahyu was mentioning just now. We have to go back to basic, reschedule the children, identify them early, and try our best to get back that 18 months loss that we have over the last year from March 2020 until now. Hopefully, we can still manage to overcome these issues, improve their problem with underweight, and hopefully try to reverse a little bit in terms of the brain function of those children who probably have started during this period of time. Thank you very much, Dr. Sri.